Welcome to our channel. If you need emergency medical care without insurance, follow these step-by-step instructions to get treatment and manage costs. Step 1. Go to the emergency room immediately for any life-threatening condition. Federal law requires hospital ERS to stabilize and treat all patients regardless of ability to pay or insurance status. Step 2. Provide accurate personal and contact information, but no, you cannot be denied emergency care. Treatment must be provided before discussing payment or insurance coverage. Step 3. Be honest about your financial situation with hospital staff. Many hospitals have financial counselors who can help you apply for charity care or payment assistance during or after treatment. Step 4. Apply for the hospital's financial assistance program. Nonprofit hospitals are required to offer charity care, and many will write off or significantly reduce bills for qualifying patients. Step 5. Request an itemized bill after receiving care. Review it carefully for errors, duplicate charges, or services you didn't receive, which are common and inflated bills. Step 6. Negotiate your medical bill directly with the hospital. Ask for self-pay discounts, which can reduce charges by 30 to 70%, and request a payment plan with no or low interest. Step 7. Explore Medicaid eligibility immediately. Many people qualify for retroactive Medicaid coverage that can pay for recent emergency care if you apply within specific timeframes. Step 8. Contact patient advocacy organizations for help if overwhelmed by medical debt. Groups like $4 and RIP Medical Debt provide resources and may help eliminate qualifying medical bills. Don't forget to like this video and subscribe to our channel.